Happy Wednesday, May 7th, everybody. Lindsay Stottle here. I'm a little late coming to you today. I had a procedure this morning that I had to be up and out the door for. I had a nerve block injection this morning that is supposed to help my nerve pain. It is called a stellate ganglion block. So today's topic for my day 230 is going to be what the block is. The stellate ganglion block is a medical procedure used to relieve pain or treat certain nervous system conditions. It involves injecting local anesthetic near the stellate ganglia, which is a bundle of nerves in the neck that help control the fight or flight response. This block can help treat conditions like complex regional pain syndrome, or CRPS, nerve pain, brachial plexus injuries, or BPIs, and even symptoms of post-traumatic stress disorder. By calming those overactive nerve signals, the injection can reduce pain, improve circulation, and even relieve anxiety-related symptoms. It's usually done under imaging guidance and takes just a few minutes, with patients often feeling relief shortly afterwards. Though it's not a cure, a stellate ganglion block can be a powerful tool in managing chronic pain and restoring quality of life. It is supposed to help reset the nervous system, and it, like I said, is often used to help treat chronic pain. Have you heard of a stellate ganglion block before? I might not even be pronouncing it right. I'm pronouncing it the way it was pronounced to me at the hospital this morning when I had it done. So when I went in this morning, you might actually, I'm trying now to remember exactly where it was at, right there. I don't know if you can kind of see, it's still red. So I went in. I've had this procedure done like 5 times before, but I don't believe it was ever done right, because the pain that I felt today during the procedure was nothing like I had felt before. And my doctor told me that that was a good pain because that means it's in the right place. So they'll go in this instance, it was through the front of my neck with a needle, and inject some numbing medication, and then just follow it right up, right in that same spot, of course, with guidance from, it's not an x-ray, but like a Doppler, I just completely blanked, sonogram, kind of. And so they put that right over where he thinks it needs to be, and the doctor can see those nerves, the nerve endings that were torn out of my spinal column. So he can see those nerve endings, so he knows that he's in the right place. And so he goes in with the steroid medication and starts injecting it. And boy, howdy, I about peed my pants. Yes, I'm going to announce it right here, right now. I'm not ashamed. I'm glad that I went to the bathroom before the procedure, or else I probably would have. It hurt so bad. And then the third shot, which is a second injection, a steroid injection, hurt even worse. I was almost in tears. I was trying so hard not to move because he's cut needles right there in a very crucial area, and we don't want to get it in the wrong place. But apparently I wasn't breathing. And so the nurses were like, Lindsay, breathe, breathe, take deep, slow breaths. I couldn't do that. I was like, and then I'd hold my breath. And they're like, breathe. And I mean, that's how I was. It was horrible. Absolutely horrible. And so shortly afterwards, I felt numb in my left arm, which I knew I was going to. But I also know that the effect of the actual block injection doesn't show up for 3 to 5 days. So the numb that I was feeling was from the numbing agent. And I was having a very, very heaviness in my chest, having a very hard time breathing. My left side, my eye is always droopy. As you can see, the eyelid is always droopy, but it was even worse. I mean, they forewarned my daughter, who, thank goodness to Cassidy, she was able to go with me today since my hubby isn't around, to help me today. But they warned her that I could come out looking like I had a stroke because my face was I felt like I had been to the dentist when had cavities filled. But then on our way home, I started coughing, and I couldn't cough. I couldn't take a breath deep enough to cough. And so I kind of felt like I was hyperventilating there a little bit, because I was trying to take the breath and trying to cough, and I couldn't get it done. And the whole rest of the day, I have been, my anxiety's been kicking my butt, because I was focused on my chest, the heaviness in my chest, and the fact that I couldn't take a drink of water without coughing. And so I called the doctor's office. Let's see here. My procedure was at 9:30 this morning. And about 3 o'clock, I called the doctor's office, and I said, I am still having these symptoms. And she said, she talked to the doctor. He said, yes, he knew where he hit was the perfect spot because of the amount of pain you were in, she says. And he knows that your symptoms are going to last a lot longer because of it firing, it's acting, making those nerves angry. So it's going to last longer. But not to be concerned, because he said that it will go away in a few more hours. He said, unless it gets worse or doesn't go away by like 8 o'clock tonight, then to call the hospital back. Well, when all this heaviness in my chest was going on, I was having a hard time talking even. I sounded really raspy, and I still kind of sound raspy, but I sound a lot better than what I did even an hour ago. And I actually feel a lot better. I can take a deep breath, and I can, I was able to cough enough to get that tickle out of my throat that's been bothering me all freaking day. So now is the waiting period. Now we've got to wait and see if this block helped. Like I said, I've had it before, but it didn't help before. And the difference now versus when I had it back then, I've turned my spinal cord stimulator. Max, stop. You're going to ruin that ball. You already are. Give it here. Give me the ball. Drop it. Thank you. Look, you already ruined it. You're eating the ball. Sorry, pardon me. My spinal cord stimulator was on when I had these shots before. I think I had about 5 of them before, and they didn't help. They helped the very first time, but not for very long. And so we kept going back thinking that it was going to help, and it never did. So I I figured there's no point in me continuing to get them because they were uncomfortable and they weren't helping. Well, then this past December, actually on my daughter's birthday, we decided, my doctor and I decided to turn off the spinal cord stimulator because we wanted to go through a reset and then turn it back on to see if it'll start providing more relief. And, well, it was providing more relief having it off than having it on. So I've had it off since December. That's why we decided to try the nerve block injections again. Maybe having it off with the injections will be what I need. Doctor said that he's got someone who gets the nerve block injections every 6 months. I would be thrilled with that. I'd be happy with every 3 months. If I had to go through the pain today getting the block every 3 months in order to have relief, I would totally do it because that pain goes away within minutes. Or, as soon as he quits injecting me, it goes away. So, long story, I know today's live is longer than normal, but I wanted to explain to you what it was, what I had done and why, because I've been telling you guys about my story, bits and pieces of it, as often as I can, or I try to relate to the day's topic. So, let's chat, chat below, private message me, whatever you want. I'd be happy to tell you more about CRPS or BPIs or the nerve blocks, because the CRPS and BPI is what I have. The nerve blocks is what I get. I'm an open book. All you have to do is ask the question and I'll let you know. So, comment below, shoot me a private message, like I said, or you can find me on Facebook, Twitter, Instagram, TikTok, and LinkedIn. I hope everybody has a wonderful rest of your Wednesday.